Hello guys, hi, welcome back to my channel. Today we discuss a bit about facelift surgery. Now facelift is a very commonly done procedures and a lot of people are aware what facelift is. So today let's look into more detail about facelift. We will look into what are the types of facelift, the history behind facelift, some of the relevant anatomy of facelift, and the complication of this procedure, as well as the alternative treatment. Right now, facelift actually is a procedure whereby we actually eliminate the wrinkle or the laxity of the skin, and by doing a procedure where you actually remove the excess skin and resuture it to a place where it looks tight. It actually dated quite a long time ago, many years ago, when people start to do facelift. And that the reason why we do facelift is because if we look into the structure of the skin actually is like a tent. So when you want to put up a tent, you have pole at the side, and then you put a canvas on top of the pole. So as we age, the content of the canvas is like our skin, and the tent is actually a ligament underneath the skin, right? So as we age, the content of the collagen inside the skins become lessened, but the structures of the ligament is still intact. So that is why if you imagine when the canvas starts to droop down, but the holding pole is still there. So this is similar to our facial skin, where patient will get a laxity of the face. You remove this excess skin and you resuture it back up there. So it first started when people start to do facelift, they just remove the skin, and then they found that result does not last that long. So further anatomical study shows that our skin on the face, there's a layer down underneath the skin, what we call as a SMAS layer. So SMAS, or superior muscular aponeurotic systems layer of the skin, is like a fascia underneath the skin. And by doing a combined or a dual plane facelift, we elevate the skin as well as the SMAS layer, and the result will last longer. Plane facelift layer. Now another types of facelift, or another type of how we differentiate facelift, is when we do a mini facelift and a full facelift. A mini facelift is basically when you do an incision of the skin, but the dissection is just around the cheek area. Whereas a full facelift is when you dissect down towards the angle of the mouth, you can down towards the part of the neck, or you can go upward across the zygomatic arch. Now the difference between these two is the indication for mini facelift usually with people with a minimal laxity and people who still at a younger age group between 35 to 45 years old. And if you go to this type of population, so you can actually get away with a mini facelift. Whereas if you are in an older populations, maybe about 50 to 60 years old with more excess skin, a full facelift is actually more indicated. Right, so what are the complications? The risk and complications of facelift, like any other surgery, you have a risk of bleeding, you have a risk of hematoma, you have the risk of a skin age necrosis. But specific to facelift is the risk of the damage to the facial nerve, or the nerve that supplies the muscle of the face, especially if the dissection crosses the angle of the mandible. You have the marginal mandibular nerve involvement, or across the zygomatic arch, you have involvement of the frontal branch of the facial nerve. But by being aware of this risk, the surgeons will be more careful, and we can actually avoid damaging this nerve. So what about the alternative for facelift? Yes, you have what we call as a thread lift. Thread lift is when you put thread underneath the skin and can pull the skin up. But the limitation of thread is sometimes if you have too much excess skin, you might not get a lot of difference between the pre and post procedure. But of course, there's still a role for thread lift for those with minimal excess skin, right? And nothing about thread is sometimes it will last only about 15 to 18 months, depending on the type of material used. And then you might need to redo the procedure again. But again, of course, like I mentioned, for those who have a minimal excess skin and not keen for surgery, you can go for thread first, right? Other procedures are those that we use energy-based devices like ultrasound in high intentional focus ultrasound or high field, or radio frequency devices where you transmit energy to the cells of the face the soft tissue of the face, you stimulate collagen formation and tightening of the ligament, and you can get the effect of the lifting of the face.